Ridge Medical Practice, Karen speaking.
Are we talking cancer?
Well, sometimes it can be a sign of cancer.
Yeah.
Before I was a very calm person, and recently, when I go on my social media, I see something, it just gets to me, I just get angry.
Is that you?
Yeah.
Blimey. I'll never look like that.
Do you live on your own?
My wife passed away 2 months since,
Oh, I'm sorry.
after 70 years.
Oh, you must miss her.
I do.
There we are. Okie doke.
It's a good job I've got no kids meeting.
Morning, Ebony.
Morning.
I nearly died this morning, Rihanna. I was running, and there was these 3 sheep that I'd managed to get out of the field onto the dirt path. And then I was like, oh, God, fine, just move out of the way, I'll just walk past you. So I ran. And then they charged at me.
Because I thought you were coming after them.
Well, it wasn't. I was just running innocently. I was listening to TLC.
What were you listening to?
The Creep.
Come in. Hi, love. Here you come. Hello. Take a seat, ladies. So, hello, how do you? My name's Debbie. I'm a nurse practitioner. What can I do for you?
My leg hurts on my kneecap over here.
Right.
It all started since last evening.
Right.
She can't bend it properly or straighten it up.
OK. And then when she woke up this morning, she came downstairs still...
Yeah, but
Right.
but she can't straighten it up.
No, I can see
Yeah,
she's limping,
yeah,
isn't she?
Yeah.
That's quite
Do
an
it properly.
important point, because usually with children, if it's something and nothing, it would have gone by the morning. What did you do yesterday?
I just was playing and I did some work and I don't know how it started.
You point to where it hurts for me. There. OK, now we need to have a look at it, and I'm just going to take your temperature. What year are you in?
Year 2.
That's a big grown-up year, isn't it?
Yeah.
Right, what I want you to do is I want you to take your shoes off and I want you to take your tights off. You're lovely, aren't you? Eh? Take your coat off as well, because it's... Right, come and walk on this floor. Walk over to me. Oh, darling, does it really, really hurt?
It hurts a bit.
Right, can you try and put your foot down? Does that hurt more?
It's just when I'm going to put my legs straight, it starts hurting.
Come in.
Hi, Dr. Beatty.
Hello. Come in.
Alaikum.
Come,
How are you?
come in, come
Good to see
in.
you. Thank you.
Come in.
Thank you.
Let me help you to the chair.
That's okay, thank you.
So
Thank you.
just to your right, another step.
Thank you.
There we go.
Thank you.
Nice to see you again.
Nice to see you, thank you. I think I've got a fissure or a similar kind of problem,
Right.
a hemorrhoid.
Yeah.
But basically, it's been going on and off the last 2 or 3 years,
Right.
and it's really, really uncomfortable.
Sure.
We've tried the gamut of appointments, quite a
Right.
number of things, and it's not shifting.
Yeah.
So I was wondering if we could try something drastic.
What were you thinking?
Could you try an injection, do you think?
Is there any bleeding?
Well, that's a tricky question, being visually
Because you
impaired.
can't see it, can you? No. Have you ever seen a specialist about them?
No, I've had a CT scan and stuff done.
Right, OK. What was that for?
I think just because I was experiencing a lot of bowel problems.
At the moment, when you're pooing,
Yeah.
then, does it really hurt?
Sometimes it does, but certainly afterwards, there's quite a lasting stinging and
Sure.
itchiness, and
Sure. Sure.
it's really awful.
Yeah, no, of course. Now, I know you've been examined recently.
Yeah.
It'd be good if we had another
No, that's
look.
fine. That's absolutely fine.
Is that okay with you?
Yeah, no, absolutely fine.
Okay, all right. Let's pop you on the couch.
Okay.
So, oh, I was going to come get you. I was going to come get you. So,
Okay.
the couch, can you feel
Yep,
it
got
there?
it. Thank you.
That's the foot of the couch.
That's fine. Okay.
Let me just draw this around. Well, while you're there, just let me get some gloves.
Yep.
Oh, wow, you're already on the bed. You're like lightning quick.
Well, no time to waste.
You see, because you've seen so many specialists, you know the exact position,
Oh,
your
well.
knees up, it's all done, isn't it? You're some kind of expert patient. So, OK, that's good. On the outside, I can't see any lump. Yeah, there is a little bit of a...
Pustule.
Yeah, oh, well, no, it's just a little bit of bowel.
Yeah.
There's no abscess there or anything like that. Let's get you decent.
That's right. Thank you.
So it does look like it's continuing irritation
Yeah.
like before. Have you been getting things over the counter?
I've been tried stuff like, Sudocrem.
I don't think Sudocrem's going to cut it.
Something needs to cut it, I tell you. Thank you.
There we go.
Thank you.
Good lad. OK, so why don't we try a kind of general cream
Right.
for the moment? Also, something that's got a little bit of steroid in it, as well as some local anaesthetic.
Okay.
And then if it's not helping, what I would be thinking is something targeting specifically
Right.
the possibility of a fissure.
Right.
Is that all right? So that's the prescription.
Thank you.
There we
Thank you
go.
very much.
Good. Do you want to ask me anything else?
That's it, I think.
No? Lottery numbers? No?
Well, I'm sure if you knew that, you wouldn't be here, would you?
Are you ready? First, I'll start at your feet. No pain there? No. Does that hurt?
If it's hurting,
Just say, darling, I want you to say, because
No, it doesn't.
I'm just going to move your hips. Does that hurt?
No.
This knee is a little bit swollen
Yeah,
here.
it is,
It is
it
a bit
is.
swollen here. Up you get. There's a good girl. Put curtains round you and then you can put your tights back on. I know you're not going to like this, Mum, but I would say we are very, very careful with children's joints. So I think she needs to go up to A&E for them to have a look at her.
All right.
Because swelling and pain in a joint when there is no fall, in children, often it's just their body responding to a virus or something like that, but we can't scan, X-ray, examine, but they do that up in A&E.
Yeah.
Is that
thank you.
okay?
Yeah, that
Pop
would
her
be
tights
good,
on, look. You're a mystery, aren't you?
Yeah, I was wondering as well, how could this happen? Because all the time she was in home. I mean, she didn't go outside, even for cycling.
Yeah. Do you like your bike? Do you ride it without stabilisers? Good girl. That's great, isn't it? What colour is it?
Pink.
Right, so all the best, my love. Get to bottom of it. See you later, ladies. Bye-bye.
Hi.
Hiya.
My blood test level at 5 to 10.
What name, please?
Kelly, K-double-L-Y.
Brought the sunshine out with you.
Certainly did. And you're looking dapper with the
Oh,
sunshine
thank
as well.
you.
Yeah, it all blends in together, doesn't it, for both of us, look there. Made your day, love, on
You have, yeah, absolutely.
Hey, another thing, you're sweet as a nut as well.
Thank you.
Come and take a seat, because we chatted on the phone, didn't we? You've been having some difficulty with this pessary, haven't you?
Yeah, she has a pessary. There was a bit of blood loss, wasn't there, Mum?
I'm losing blood all the time, really.
Yeah. How long's that been going on for? Was it just when it was changed, or was that happening before it was changed?
It was happening before.
Yeah.
Yeah.
Is it sore?
I feel sore, yeah.
So what I wanted to do was have a look and see if we can work out why you're bleeding, because sometimes pessaries can rub a bit inside and it can cause a bit of discomfort.
Right.
But the other thing is we need to just have a look inside to make sure there's nothing else that might be causing the bleeding that might warrant a referral to hospital. So shall we have a look and see?
Yeah, you can, yeah.
Yeah. Right. So let's just get you up here. OK, you all right there? Let me pull this round. So, I'm going to put a hand on your tummy first. They're cold, though, on my hands, I'm afraid.
Not to worry.
OK, so I just need you to relax these knees, OK? I think I'm going to take this pessary out today.
Okay.
So that I can have a look and so that we can give you a bit of a break inside, all right?
Thank you.
Right, let's just have a little look. You all right?
Yeah.
OK. There we go. You OK there?
Yeah.
Yeah, there is quite a lot of blood in there, isn't there? It's difficult to see exactly. Yeah, right then.
You all right, Mum?
Yeah, fine.
Come here, love.
Right, so looking inside, there is quite a bit of red blood, actually. It's not easy to see any obvious place where it's coming from or any obvious cause for it. I think it's most likely that it's that pessary that's caused irritation inside.
Oh, God.
But I can't be certain, and I think the best thing to do will be to ask the gynaecologist up at hospital to see you soon.
Right.
OK? Because sometimes bleeding after the age of the menopause can be due to other things.
Right.
Problems in the womb or problems in the vagina. I can't see anything there, but, you know, it might be deeper inside.
Yeah, OK.
Sometimes it can be a symptom of cancer, so that's why I want hospital to see you.
OK.
Yeah? And see you soon. Get it over and done with. Yeah?
OK.
Let's get your trousers.
Okay.
There we
Oh,
go.
you're lovely. Thank you very much.
That's all right. So,
Thank you.
my job now is to write to the hospital and
Right.
see if they'll see you. Like I say, it'll probably be within a couple of weeks, but I think it gets it over and done with, doesn't it?
Yeah. Are we talking cancer?
Well, sometimes when you have bleeding after the age of the menopause, it can be a sign of cancer.
Yeah.
So I think it's better to be safe than sorry and go be seen up at the hospital.
OK.
OK?
Yeah.
I'm going to give you some cream as well, though, in the meantime. There we go. OK? All
Thank
right,
you very
Mama.
much. Thank you very much.
OK,
You've been
you
lovely.
take care.
Thank you.
Thanks for coming in. Thank you
Thanks
for bringing
ever so
your mum in.
much.
You got the door. There you go.
Right, thank you.
OK.
It's cancer.
Mum, she didn't say it's cancer. She said it could well be the cause of the pessary. It's been left in 3
Yeah.
months over.
Or it could be cancer.
Yeah, so you've just
know.
got to...
I know, Linda.
You've
I
just
know.
got to wait and see.
I've got these 2 students with me today.
Oh, yeah.
OK, fire away, ladies.
So how can we help you today?
So I'm just going to lift up. And if the student just has a feeler. So if you just...
Jaundice people, I always thought, how can you tell if someone's jaundiced? And
Yeah.
then someone came in, I thought, right, I can
That's
I can
jaundice,
see.
exactly like Simpsons.
Yeah.
If you just flick that like that, just gently. Feels like a guitar string.
If you feel mine, I've got 2 good ones there and there.
Oh, yeah.
Yeah, so that's what you're feeling for, essentially.
Good job. OK, well done.
I really enjoyed it, actually. It was satisfying as the first one, yeah.
Cheers to the 2 of you.
I'll drink to that as well. Cheers. Hello.
Morning.
Hello, Mrs. Attar. Come in. Right, come and sit down. Hello. Right, Smee, do you want to come and sit down as well?
OK.
So do you mind if Smee tells me a little bit about why... Thank you for speaking to our students, by the way.
it's fine, yeah.
Great, thanks.
Okay, so this is Miss Actor. She's come in with 2-3 week history of hot pain, starting in the elbow. She's tried using some ibuprofen gel, some painkillers, that made no difference. With the pain, it's probably more so on the lateral side.
Yeah.
She's got Sturgeon syndrome, and she was told that sometimes she gets some rheumatism as a side effect. I was thinking that possibly it could be more so rheumatoid.
So, you mentioned rheumatism because she mentioned Sjögren's syndrome. Any other
I think
ideas?
it could be a trapped nerve as well.
Could it also be golfer's elbow?
Yeah.
Tennis elbow.
Tennis elbow,
Yeah,
that's
right. OK, so now we're on the right
Yeah.
lines.
Yeah.
OK, because she's got tenderness.
Tennis?
No idea. So, the other name for tennis elbow is lateral epicondylitis. Yeah. OK. It is so important that students come to GP surgeries on placements to learn what they see here, the interaction between patients and their doctors, the conversations that we have with families can't be taught in classrooms or from textbooks. So seeing that firsthand, there's no substitute for it, really. So what might she be doing on a daily basis that could cause this?
Helping the daughter.
Yeah.
It's all your fault.
Oh, look at that face.
I work in a school. I help children with disabilities. I help them a lot. And obviously this one, she needs help as well. So,
What's your name, darling?
Khadija.
And what does your mum do for you to help?
She pushed in the wheelchair. She helped you out.
Does she? So now we think you've got a condition called tennis elbow or lateral epicondylitis. Now we've got the diagnosis, we need to come up with what we can do to help. So she's tried ibuprofen gel, she's tried ibuprofen tablets, and they are certainly options.
Steroid injection.
Right, now we're talking, because that will give you probably the quickest relief, really.
I would prefer something quicker, yeah.
Do you want it now?
I don't mind it. If it helps, because it's got to a point where it's just annoying.
Yeah. Right, let me draw it up.
So what do you think? Marks out of 10?
Yeah, come on, Khadija. How did they do? Not me. I'm 10. Go on. What are we going to give Eleanor first of all?
9.5.
9.5. That's not bad, is it?
That's a good score.
What about Samit?
Same.
9.5. Oh, I think
Yeah,
you've
you always got to leave a little bit for the challenge.
Yeah, I like that. That was fun.
Right, sharp scratch. And with tennis elbow, you want to try and cover as much of it as possible. And I would just fan a little bit out. Timmy, just press that down for me, so we're all done. How was that?
It's all right.
10 out of 10?
Yeah.
What do we reckon, Khadija? Come on. Yeah. Throw me a bone. 10 out of 10.
She's always having a
Hello. Are we all right?
You look very tan. I agree.
Do you think?
Yeah.
I'm still Menorca tan. In the summer holidays, they made me do this CCG video about the sun safety with children called Slip, Slop, Slap, about putting on sun cream. And there was me, like, really tanned. I'm so not the right person to do this. Really.
That's so funny. Hi, I'm Dr. Tatham.
Hello.
Hello. Right.
Oh, this has been going on for so long now.
Right.
And it's just basically, I started last year in May with a problem in the top half of my back, in between my shoulder blades, when I sort of try and like bend over a tiny little bit and breathe in. It's really sharp pain. So I tried everything. I've been for acupuncture, I've paid for physio, I've paid for sports massages, I've paid for a chiropractor, I've tried naproxen, I've tried tramadol. Nothing was even masking it. It's the neck pain. That is something that I've had ongoing for probably about the last 10 years of my life. It's like a really hot, intense, sharp pain down my arm. What I get around here is a hot, stabbing, dull, constant, aching pain.
Right. What's your main worry about all this?
That it's not going to go away. It's yeah. Go
Show
on,
me if you want.
doctor.
As long as it's accurate. A bit like Brad Pitt.
Well, you've got a strange growth coming out the top of your head at the minute, so I can't say that's particularly accurate. It gets me down.
Okay.
It makes me ratty with my kids.
Has this stopped you doing anything in particular?
It stopped me doing upper body exercises now. I can't do lateral pull downs or shoulder raises. I can't do anything.
Yeah.
This is what my back did look like 3 years ago.
Is that you?
Yeah.
Blimey.
I'll never look like that.
I can tell you that for nothing. I want to have a look at your back.
Yeah.
So I'll just go and get a chaperone, all right?
Yeah, cool.
2 seconds.
Yeah.
Right, then. Right, this is Adi. So, just take that top off for me and we'll have a good look at stuff. Right, can you just point out to me where you're feeling that pain now?
It's just all there.
In there, right. Right, can you twist round to the right? Oh, it's stiff. And twist round to the left. Right, push that wall over for me. Don't actually, I'll end up in trouble, but pretend. Does that seem to aggravate any of your symptoms? It does?
Yeah.
Right, OK. Follow me, so go out to the side with your arms, and if you get any pain anywhere, just tell me where it is.
You know. All
There.
down there, yeah.
Right. Pop your top on, thank you. OK, so what I think this is it's the muscles between your shoulder blades that aren't quite right. So if you want a proposal from me, it would be that I get you some NHS physio and...
I've done all the muscle building stuff like that before, so I know how to strengthen the muscles in my back.
I know,
so I
but
just
it's
think,
slightly
you know,
different.
I know, but
It's slightly
I don't know.
different.
I just feel like I think I have had physio for this. If you look back on my record, like 10 years ago, there's some. I just feel like I'm just going through the motions with it. I feel like
I understand
Do you not
that.
want it to get it today? I wanted you to come and refer me for an MRI scan.
A lot of people do.
Yeah.
And I understand why people want the scan and feel as that's
Yeah.
going to give us the answers. But from
Yeah.
what you've told me today,
Yeah.
I really don't think it's going to further our journey
Right.
whatsoever. An MRI scan would show us when something is broken or misaligned in the back. In most cases of back pain, that's not the case, and the pain results from the way we use our back or misuse our back. And so an MRI scan wouldn't demonstrate to us anything having gone wrong, and therefore is often very unhelpful.
I would be amazed if hospital physio sorts this out, because it's been, like I say, it's been.
I will
5
tell you
years
now,
in the
6
making.
sessions of hospital physio isn't going to sort this out, OK? But it's going to take some months of you doing
Yeah.
to really notice the difference.
Okay.
I've got a lot of sympathy for patients who come to us with an idea about what treatment that they should have. But as gatekeepers to the NHS, we really do have to keep a handle on what we refer patients for. What I'm going to do is leave you with an open appointment to come back, and then we can talk about what the next
Okay.
step, which may be imaging, but we'll talk
Right.
about that then.
All right.
Right, OK. Can I
go.
keep that for my notice board? No, that's very good of you, thank you. Nice to meet you.
My hair is so short.
Short?
Yeah.
It's long. My hair's short.
But look, like it's just short.
Hi there, I'm Linda Eves. How can I help?
I've been getting really bad migraine headaches all this side, and I can't like lift my head up.
So is it like a throbbing kind of a headache?
Yeah, like I can't drive my car.
Okay.
I can't get up.
Yeah.
Like my eyes are burning. I feel very, very tired, lazy, moody.
It certainly sounds like a migraine.
Yeah.
Have you had migraines before?
No.
Okay.
No.
When did you last have your eyes checked?
It's been a couple of years ago.
All right.
Yeah. I think I need to book a
Yeah,
X-rays
I was going to
as
say.
well.
Would you say anything seems to make it worse?
Oh, just like general stress, like, I don't know. Like my family's saying to me that you might have bipolar because I'm moody all the time.
Okay.
Like normally I'm a completely different person.
Let's just check your blood pressure if that's all right. Have you ever felt that you might hurt yourself in any way or not?
No.
We have to ask these questions when
Okay.
people talk about their mood. Your blood pressure's fine, okay? It's just, I'd like you to tell me a little bit more about your mood.
I just like feel very, really moody.
Crying a lot?
Yeah, crying a lot. I've been like my own world for some reason. Like, you know, like small thing I make it big issues, like in my head.
Yeah.
Before I was a very calm person, and recently, even I'm on the phone to my friends, I've been just like flipping, shouting at them. I just get too scared as well.
Scared?
I don't know, I don't want to go through depression or bipolar and stuff. I just want to be a normal person.
She's scared now, honest. I'm always scared now. Any pain I get, I'm like, I hope it's not sepsis. I hope it doesn't come back.
You nervous?
No, not too bad.
Yeah?
Do they numb me first?
You'll be okay. I'm here to hold your hand and to talk nonsense to you in your ear.
If I hate this.
OK, so just a sharp scratch.
Oh, are you okay? You're being really brave, I know you.
I just can't stand it, honestly. I'm not joking. I just can't. No, my life has gone this way.
How are you feeling about it?
We're all right. I'm a little bit nervous now, to be honest with you.
Are you? Why?
It's your neck, isn't it?
It'll be all right.
I'm not gonna lie, I'm nervous.
You're nervous.
I'm
Don't be
nervous, I'm
nervous.
scared.
Oh, don't be scared.
Have a seat. I'm Dr. Tatham. So,
There's only 2 ones that I really want moving. He said you're only going to be able to do 1 though. But the other one is literally on my leg and I've caught it and it started bleeding.
right,
That's the only reason I wanted that one off.
we'll have a look and we'll see what's what.
Right, okay, so you lay back. Right, okay.
I've been dreading this all day. Oh, we're going to actually ring up this morning and cancel it, but my mum shouted at me, so I didn't.
Don't worry.
She had a right go at me.
Are you okay?
Yeah.
Right, where am I looking?
It's just sort of like on my right bum cheek kind of thing.
And where's the other one? Yeah.
That's just there. That one catches on my clothes, but it goes up like a little dried up Rice Krispie. So I've started wearing high-waisted pants now so that it doesn't catch on it.
Well, they're fashionable, aren't they? Are they fashionable?
So,
Yes,
yeah,
they are.
very fashionable.
Right, so...
You are going to numb it though, aren't you? I'm not,
Yeah,
I'm
yeah,
not
yeah.
gonna say I'm not going to feel it.
Yeah. Tap.
That's not your needle.
Oh, we're going to say.
Yeah.
No, you get the small
Yeah.
one.
We're not that mean.
Oh, God, look at the size of that needle.
You okay? Don't worry.
Right, roll over onto your side towards Karen, if you don't mind. It's a right awkward place, isn't it? There we are. Okie doke.
You okay there?
Mm-hmm.
Oh! It will sting. It will sting.
Oh, no, that's hurting. Oh.
OK, so if we take a little look at these questions, OK, how often have you felt down, depressed or hopeless?
All the time, honestly.
Do you ever feel bad about yourself or like you're a failure or you've let your family
I feel
down?
down about myself,
Do you?
yeah.
How often have you had any trouble concentrating on things like reading the newspaper or watching television?
Yeah, I don't like watching TV.
OK.
It just gives me depression more. Like, when I see things, even like when I go on my social media, I see something, it just gets to me, I just get angry.
This just sort of gives us a baseline score so that as you get help and treatment, whether that's talking therapies with medication, we'll be able to see hopefully some progress over the next few weeks when we look at the same questions again. The best treatment for people who are experiencing low mood is some talking therapies. How would you feel about that?
Can I not get any medication that like lifts my mood up?
Is that what you were hoping for? Is that what you were expecting?
I need something that makes me better. I want to feel normal, like other people feel normal.
We could try you on a low dose of medication, but I just want to emphasise the fact that it is good to have talking therapies alongside that. Let's settle this migraine down first.
Okay,
that should sort that out. And then let's start on a low dose of something called sertraline. Is that OK? And then we'll be in touch in a couple of weeks and see how things are going. All right? So try that number or that number for counselling, or you can come in and see this lady. Now, for some people with this medicine, they do feel a little bit worse in the first few days. Hopefully not a lot worse, OK? But it's not a quick fix.
OK, thank you so much. Bye.
Bye-bye.
Bye.
Right. It's a bit sensitive around there.
Mm.
Gonna squeeze my hand?
Oh, she's good
Told
at
my
holding
mum she
hands,
should have
is
come with
Karen.
me.
Oh no, it's my role. What are you normally doing on a Monday?
But I would have normally been at work.
Right.
Okie doke. So, let's sort this one on your waist, shall we? Perfect. So this will sting.
Well done. Well done.
I don't know how I can moan about this. I've had tattoos. They hurt a lot more.
Right, here you go.
Okay. Can you feel anything?
It's just a little, like, tugging.
Oh, you feel tugging,
yeah.
Nothing sharp.
Okay. Gone.
There you go, not too bad, eh?
Okay.
Okie doke.
Right, last one.
Last one.
Well done, well done. Well done. It'll ease in a minute, literally seconds.
There you are, worst bit.
It's a good job I've got no kids being it, because I don't know how to get through to
You do it.
Oh.
Right.
There you go.
Is it done?
Yeah.
That was the least painful.
That's good. Save the best for
That
last.
one up right swell.
Have you?
What did you do this weekend?
Went to Aberystwyth.
Where's that?
It's in Wales.
You went to Wales?
Yeah, I went on Friday, came back Saturday. Megan...
Came back Saturday?
Yeah, I went to a uni open day with our Megs on Saturday.
Uni?
Yeah.
In Wales?
Yeah. She looked at Banger already, and this is the other one.
She looked at what? Banger?
Banger.
Banger? Banger and Aberystwyth. Am I saying it right?
Aberystwyth.
Aberystwyth.
How can I help?
I've got a leg infection, right leg.
Okay.
How long have you had that for? Antibiotics, and it's still ain't cured.
How have you got this infection then?
I walked into a road sign.
Okay.
Well, not a road sign, a street sign. Everybody else puts them on a wall. Not a great Yarmouth in Norfolk. They pull them out about a foot away from towards the edge. Bright sunny day, I moved over to let somebody pass me on this side. Straight into it. Bang.
Have you had any temperatures at all or anything like that? You don't feel unwell in yourself?
No.
And do you feel your leg is red or hot or anything like that?
It is still warm.
Yeah.
Check this off. I've got monkey toenail actually now.
And where did you knock yourself in the...
Where the scabs are, just go in.
Just pop your leg down for me, please.
Ow.
And is this what your leg normally looks like?
No.
It looks more red to you?
It's more red to me. It is on the night. It really flared up and it burns.
Well, it doesn't feel warm the way you were saying.
So big, back of there. Yeah. That's normal.
Are you not feeling breathless or anything like that? You're not feeling short of breath or anything?
No.
Okay, well, there's a lot of water.
It's fluid, isn't it, on that?
Yeah. So I'm just going to give you some tablets for that.
What tablets?
Yeah.
Yeah, my wife's had them. She's feeling good in the toilet. Cheer up, might never happen.
So I'm not going to start you on any antibiotics, okay? You've had 2 weeks.
2 lots, yeah.
It's going to mess up with your bowels. Yeah. It doesn't look too bad to me there, okay? Keep an eye on it. Try to keep your legs elevated. You're not allergic to anything, are you?
On an ex-wife. Best thing I've ever done. We're still friends, and that's as far as it goes.
That's good, isn't it? So you know what you're doing, yeah?
Yeah.
So I want you to keep an eye on the leg, okay? If you think it's getting worse, you need to come back and I'll have another look.
Right,
See you later.
Right, thank you.
Bye.
Open wide, Henna. Stick your tongue out, say ah. You're never really off duty in the medical profession. Staff ask you questions from the girls in reception, admin, and you're always sort of watching out and about.
If there's somebody in the public who might need your assistance, you will do what you can to help them.
It's a 24-hour job.
There was one time that I was waiting for my luggage in an airport and a lady collapsed. She wasn't breathing. There was a defibrillator nearby. After 3 shocks, she did regain consciousness, which was amazing.
So I think the most exciting out-of-hours incident we've had was the birth of our son, Henry. You delivering Henry.
Daddy was midwife
Out
at
Henry
home.
came.
I was trekking in Nepal, and one of the ladies in front of me tripped and fell and broke her arm. I managed to get a plank of wood and padded it with newspaper, and we used some scarves to wrap around it, and then she was able to walk back to the road to get to the hospital in time.
I'm here.
She wanted Chris dead.
Give us a shout.
Yeah, if you feel poorly, let us know. There was one time at the gym where a man was talking about a rash in his groin and suddenly just pulled down his pants right there in front of everyone.
Give it another week. If you get worse, seek doctor. All right, my darling. Drink plenty.
Hello, hi. What can I do for you?
I found a lump under my arm. I say it's the size of a pea.
Mm-hmm.
It doesn't hurt, but it's definitely a sore feeling.
You've not noticed any discharge from there?
No, well, it's not like a spot or anything. Finished, I felt the lump. I thought, well, you automatically think about it. You know, cancer, anything like that. So I thought, well, I'll get it checked out by you guys. The only reason I'm really concerned about that is because my dad died of cancer. So whether it's in your genes or if it's, do you know, hereditary, I'm not sure. But I thought I'd get that checked out.
Okay. And what kind of cancer your dad had?
It basically was riddled with it. It was everywhere.
Come in. Good morning.
Good morning,
take
love.
a seat, love. Is it Beryl?
It is, love. Back where, love?
All right, my love.
Right, OK. And you wanted to book another appointment, did you, my love?
Any time, any day, love.
I think you'd benefit from some steroids today. What do you think?
You all right, love?
You're right.
All right, love.
Deep breaths, my love. And out.
Hello.
Hiya, love. You OK?
Yeah, yeah.
Yeah.
It's all right, carry on. I feel so sorry for you, love.
It's one of them days, love. Don't worry about it.
All right.
right then, my love.
Thank you.
Bye, Amy.
Come on, Bubba.
See you later.
Ta-ra, love.
In you come, my love. I'm Debbie. So this is baby Dylan. He's 9 weeks old.
Yeah.
And your mum.
Yeah, I am, yeah.
And today Dylan's come for his 8-week baby check. Have you got any more children?
Yeah, I've got 4 at home.
4 more at home?
Yeah.
Wow, so he's your 5th.
Yeah, he's my last.
Your 5th and your last, definitely. Well, we'll talk
Kept trying
about
for a
that.
girl, but all boys.
Have you got 5 boys?
Yeah.
Fantastic. And there is some very rare syndrome that touches your family a little bit.
Yeah, I've not seen any.
But you've not seen it. Has
No,
any of your
I've
other children got it?
My eldest and the one just before him.
Right, so it's called Waardenburg syndrome. Yeah.
It mostly affects the hearing.
The hearing, yeah, and
but
some
he passed
pigment.
his flying colours.
He's passed his with flying colours. So you know all about that and you're happy with it. Right, my love, so I want you to take all his clothes off, leave his nappy on.
Hello, chunky monkey.
Hello. Hello, darling. I'm your Auntie Debbie. I'm going to turn my light off now and look inside his eyes.
Sometimes he goes a bit boss-eyed. Is that normal?
Babies, you in the first couple of months often go boss-eyed.
Oh, okay.
His look fine today. Keep your eye on it for 3 or 4 weeks. If you see it again, we want him to come back.
Okay, then, no problems.
Just going to listen to his heart. What are we doing to you? Oh, yeah. Right, so his heart sounds are completely normal. He's breathing beautifully. Just check his testicles.
Yeah.
One there, look. One there. He's got both of them down already. So if you dress him but leave his legs out, and then I'll get his injections ready while you do it.
Hey, isn't that fun?
But until your oldest child had this syndrome, did you know anything about it, or was it?
My mum's got it.
No.
Yeah, my mum's fully deaf.
All right.
Yes.
Did she sign or did she live free?
We all sign in the family.
Yeah.
Her mum's deaf. Her dad's deaf.
Right.
I'm partially deaf in
Are
this
you
here.
partially?
Yeah.
Pop him on your knee when he's ready, my love.
Coming in you.
No need to rush though. So, the first thing he's going to have is drops in his mouth, and the drops protect him against a virus called rotavirus.
Yeah.
They taste nice.
Oh, okay, that's good.
Rotavirus is a very nasty diarrhea and vomiting bug. Now then, you'll like these because they're like sweeties for babies. A big bruiser like you should love these. There you go, aren't you clever?
He won't turn anything that goes in his mouth down.
That's what we like, though. Big strong babies, there's not like them, is there? So if you put your hands around his middle, I'll deal with his legs. He's going to scream like mad. His
Yeah,
legs are
I'm
going to bleed.
expecting
You're
it.
ready, aren't you? You're a sensible lady. 1, 2. First one done.
I know, baby. Oh, bless him.
All done, darling. There you go. All done. I'll have that in a minute when it's settled. There you go. Get that done. What did the nasty woman do to you? There you go. There you go.
Oh, darling. Oh, bless him.
Where do you feel the lump?
There. Just put your finger right there. Feel it.
Because I'm rubbing off my finger on it, isn't it?
Yeah, it's only so it only hurts slightly if you push on it.
Yeah. It's a tiny, small lump, isn't it?
Yeah.
Yeah. Okay. I'm just gonna feel your armpit if you don't mind. Okay. Okay. Can I see the other side as well?
Yeah.
Okay, that's fine. And should we? Yeah, you can put on your shirt. About the lump.
Yeah.
So this lump, I know you said you were worried about cancer.
Yeah.
It doesn't look like a type of lump that we would see with cancer. It's something we call folliculitis. What it means is that we do have hair on our body in different regions.
Oh, yeah.
When one of the hair somehow falls and infection gets entry into the root of the hair, that causes a bit of swelling. That's what it is.
Oh, okay.
So it's nothing but the blockage of the hair root.
Yeah.
We don't need to do anything specific to treat it. It gets better with time.
Yeah.
And most of the time, it resolves within a week or 2 weeks' time.
All right.
Just examine it after a week. It probably would have gone.
All right, brilliant. Cheers.
Thanks a lot.
Thank you.
Thank you.
I'm talking to an 80-year-old this morning. She says, doctor's asked me to book a telephone call. And I went, right, OK. Tell me which day is best for you. And she goes on, this is what I do this and that. And I go to the gym on a Tuesday. I went, what?
Well, my granddad's nearly 90 and goes to the gym 6 days a week.
She says I'm 80. And I've been going every week for the last 25 years. I thought,
Oh,
you
my
know.
gosh.
Yeah. Got to go and join them myself.
Mr. Robinson.
Yes.
Come in. Right then.
Yeah.
How are you?
Well, not so bad apart from my leg. The trouble is, you put up with it during the day, but I do stumble a bit with it. But it's at night in bed that's where it's worst.
Yeah.
You know, you get interrupted sleep.
So where exactly do you get this pain then?
Here. It's here mostly, but same as I come this morning, it's going down my leg. Yeah.
Shall we have a look at you?
Yeah.
You take your jacket off.
Yeah.
Do you live on your own?
My wife passed away 2 months since,
Oh, I'm sorry.
after 70 years.
Oh, 70 years, gosh. Oh, you must miss her.
I do.
Yeah. Do you think that keeps you awake a bit at night as well?
Pardon?
Does that keep you awake a bit at night too, or...?
It's getting up to sleep, you start thinking.
Yeah, yeah. Have you got family nearby?
Yes, yeah.
Can I untuck you?
Yeah.
I do think you look incredible for your age.
Yeah.
You're 93 now?
Yeah.
What's your secret?
Yeah, a pint now again.
Good lad. Right then. Do you get out and do much walking?
Not a lot.
Do you get out the house at all much?
Yeah.
Yeah?
Yeah.
You got friends nearby? Good.
Yeah, yes.
Can you feel that?
Yeah. Just outside here.
More that side, yeah?
Yeah.
Just put your leg back down. So you feel it when I press?
There, yeah.
Yeah.
There.
Yeah, so it's right on the outsides of your thighs here,
Yeah,
isn't it?
yeah.
It does definitely seem more pain in the hip, doesn't
Yeah,
it,
yeah.
that's causing this.
Yeah.
So I think best thing is to try and keep as active as you can. So a little bit of walking will help. Do you think when you're out and about it might help to have a stick? Have you got a stick?
Yeah, I have one.
Yeah, just so you can catch
Yeah,
yourself
yeah,
and just... What we don't want is for you to fall over, do we?
No.
Yeah. So there's this issue of the pain at night. Do you think it might help if I give you something that might help you sleep but might help a bit of nerve sort of pain? I'm thinking of a tablet called amitriptyline that might help you sleep. Should we give it a go?
Yes, if I can put my glasses on.
Oh, yeah, forgot about them. Good job you remembered, didn't it?
Thank you.
There we are. OK. So, I'll give you a ring in 2 weeks, OK? Any problems,
Thank you.
just let us know.
Right, thank you.
Give that a go and see how we get on.
Yeah, thank you.
But I think it's probably that hip, you know.
Yeah.
You've probably got a bit of wear and tear in it, haven't you?
Yeah.
It's had 93 years of use, hasn't it, eh?
All wear and tear.
You take care of yourself, all right? Bye-bye.
Thank you very much.
All
Right, lovely to see you. And thanks for sharing that with us as well.
See you later.
Sorry about it.
Not at all, not at all. Nice to see you again. I hope I don't
then.
see you, obviously, for a long time, but
Yeah,
well,
so do I.
all right then.
Bye-bye. There you are, hold your jumper. Bye-bye. He's